This is the human heart. It is somewhat conical in shape. It has 4 chambers, the right and the left atria, the right and the left ventricles. The heart is described as having 3 borders. They are the right, inferior and left borders. The right border consists entirely of the right atrium. 2 ventricles contribute to form the inferior border. Most of the contribution is by the right ventricle. The left border is mostly the left ventricle. Uppermost part of this border is formed by the auricle of the atrium. The left ventricle forms the apex of the heart at the junction of the left and inferior borders. The heart has 3 surfaces. They are the anterior or the sternocostal surface, the inferior or the diaphragmatic surface, posterior surface or the base of the heart. All 4 chambers give their contribution to form the anterior surface. They are the right atrium, the right ventricle, the left ventricle and the auricle of the left atrium. The diaphragmatic surface is made up of the 2 ventricles, 2/3 of it by the left ventricle and 1/3 of it by the right ventricle. The base of the heart consists entirely of the left atrium. The left atrium receives blood from the lungs by the way of 4 pulmonary veins. The right atrium receives blood from the rest of the body by the way of superior and inferior vena cava. The right ventricle tapers upwards into the infundibulum, at the summit of which commences the pulmonary trunk. The aorta takes origin from the left ventricle. Let's take a look into the interior of the heart. Blood from the right atrium passes into the right ventricle through the tricuspid valve, and blood from the left atrium passes into the left ventricle through the mitral valve. Semilunar valves are located at the origins of the pulmonary trunk and the aorta. 2 atria are separated by the interatrial septum, and the interventricular septum separates the 2 ventricles.